The reason they're getting tested is because they're healthcare providers, but they're not presenting with aggressive symptoms at all. Sometimes this is tracking with comorbidity, so underlying health diseases that you might have otherwise, but not always. There have been some case reports of people who are greater than 80 that have been tested, and they tested positive and they did not have any symptoms. So it's been a tricky virus in that aspect because we do have some general guidelines to follow for this is how it most often acts, but they're not hard and fast because we definitely see exceptions to it. So if you do come down with symptoms, my biggest thing that I want you to take away from this is don't panic, because the majority of the people have very mild symptoms and recover very well. And so what they don't want people to do is to become overly anxious and stressed, because that is shown to deplete the immune system. And also, we don't want people to go to the ER because they're anxious and they're having shortness of breath because of anxiety, because that can also happen. So keeping just a very calm disposition is really important. And just realizing that if you do get it and you handle it well, then you're immune to it, at least for what they think is the next year, similar to the flu virus. They're still doing testing to see, is this going to provide lifelong immunity, or is this just going to be more of a seasonal thing that will eventually vaccinate for, like the flu? So coming down with the illness, if you tolerate it well, could be a good thing, because then you've been exposed, you likely won't be re-exposed to where you can acquire that infection.
Can I put in just a quick second here?
Oh, Barbara, I can't hear you. Hold on.
I am recording this for the Inform Montessori blog, so I just want to let people know that.
Sorry. Hold on, Barbara. I can't hear you. Just a second.
Okay,
I can hear you now.
Okay. I just was saying, letting everyone know I'm recording this for the Inform Montessori blog, so if you don't want your picture to be on here, if you ask a question, you could turn your video camera off. Hope you keep it on, but I just wanted to let you know that, okay? Thank you.
Okay. So let's go through some of these things. So the reason social distancing has become so important, and the flu has not been a great comparison, but it's really the only thing that we have to compare to that the general public knows a lot about. And so with the flu, we have, vaccination that we can use to prevent transmission. And then we have Tamiflu and other antivirals that can help when people acquire the illness. With COVID, we don't have anything like that yet. Vaccine development takes at least 18 months with the trials and the safety that's needed to roll out a new vaccine. So it's going to be a while before we have anything like that. And then there's going to be a worldwide demand. So they're probably only going to vaccinate high-risk populations first and then have a trickle-down effect from that. The other thing, too, is that they're investigating medications to treat COVID, but so far everything's very preliminary. And even the best trials that we've done that show the best promise, it's not definitive. So we've seen some people improve on it, but some people don't. And so there have been reports, if anybody has heard of some of the medications like hydroxyquinolone, of people trying to get this over the counter because it is in some pet cleaning supplies. That's obviously highly advised against. There's been ER admittance, some people who've tried to take that themselves for prevention or give it to their pets. The only time that hydroxyquinolone is administered to treat COVID is if somebody is under hospital supervision. So it's not something that would ever be given outpatient, and we don't recommend people trying to acquire some on their own to take that for prevention. And the data is still out, but it's not shown to be extremely promising at that. But there's lots of medications under investigation. So those are the two things that they're working on that we don't have now. So our biggest thing to fight the spread of this is going to be social distancing to effectively act as a vaccination, because the vaccinations just decrease the transmission and the prevalence, how many people are infected with an illness. If we can slow that number down, then for the purpose of looking at infrastructure, supplies, antibiotics, personal protective equipment, all of those things have a chance to get restocked and do more production before the next wave of people get hit. And that's what we're really aiming for. Likely, I mean, we project that 50% or greater of the population will be infected with this, but we need to slow that down so that all the people who need ICU care don't go in the 20-day period, because they're basically going to have to pick and choose who gets a respirator and who doesn't. If we can slow that down and that happens over the next year, then people can kind of cycle through, and that's the goal. So social distancing is very important. And from what we've been getting from clinical updates, our peak in our area is projected to be mid-April, mid-May, but this has been fluid. So we're still on that upward curve, but hopefully after mid-May, we'll start to see a downturn. There were some reports in the news that China had their first couple of days without new cases. So that's encouraging. So it's been here since December 10th that we know of. It's likely been here before that. The CDC actually, they monitor different clinics around the United States, and they saw a big spike in flu-like illnesses in late February, and they actually are thinking now that that was probably COVID-infected people. So it's probably been in the US a lot longer than we think that it has. And those people likely just had a mild illness and recovered. Why are US patients presenting differently? So in Italy and China, what we saw was that it was affecting the older population. Young kids were assumed to be just carriers, and middle-aged people, if they were otherwise healthy, seemed to be do really well with the virus. In America, we've seen what appears to be a little bit of a different pattern in the fact that we've had younger, healthier people become affected. And the demographic that is going into the hospital is not as elderly as what's seen in Italy and China. That could just be skewed data, so that could all straighten out as we get more data points on the map, but it also could just be because generally in America we have a poorer diet, we're not as active, we have more comorbidities. So we're trying to look at that and tease that out. Smoking and vaping are known risks for complications. So the CDC, it's not specifying that on like a high-risk individual, but we know that people who smoke or vape tend to have poor outcomes and have more hospital admittance with that. So if you do that, reducing, quitting, all that will be helpful. The lungs start to recover right away. But consider, take extra precautions to prevent transmission for those reasons. So social distancing, the reason they recommend 6 feet is because this is shown, they suspect that this is transmitted through aerosol transmission, which means that when you cough or sneeze, you have the droplet particles where you can see, a droplet lands on a table and you see that there. But aerosol is that mist that goes into the air, and that can travel up to 6 feet and linger in the air. And so if people are 6 feet away from each other and they're wearing a mask, it greatly decreases the risk of transmission. It doesn't necessarily 100% prevent it. The gold standard for that is an N95 mask because it seals around the mouth. It doesn't allow any air movement through the sides of the mask. And that's why those are recommended specifically for healthcare professionals, because we're doing swabs. And so that person's going to get swabbed and sneeze, and then there's going to be aerosol all over us. Okay. The next best thing, if you don't have that, are the cloth masks that go around your face. But these can, in some cases, they can actually put you at higher risk if wearing a cloth mask causes you to touch your face all day long because you're adjusting the mask. So they're asking people, if you're wearing a cloth mask, first of all, if you can do a homemade version, they're recommending that because they don't want to take away from the supply from healthcare workers because they realize that we're at a very short supply. And that's why it took so long probably to have the recommendation out for the general public to wear masks, because they were scared of the supply chain. But if you do wear a mask, you want to make sure that you never come into contact with the outside of the mask. And then when you take it off by the elastic around the ears, and then place it in a paper bag, okay? And then make sure that you can differentiate between the outside and the inside of the mask. So if you're wearing a homemade cloth mask, I'm not sure if you can tell with the fabric being different on the inside versus the outside, but that would be important because you would never want to put the outside up back against your face again. And so what they're recommending is you can put that in a paper bag when you're not using it, and then only handling it by those elastic bands and putting it around your ears. If you're going to touch the mask or touch your face, they recommend washing your hands before and after. So to use a mask safely and effectively, there's a lot of precautions that have to take place. And if somebody doesn't think that they can do that, it may not be that much more helpful. You may just want to make sure that you're staying home and keeping distance from everybody that way. The paper bag basically just helps keep the mask contained so that somebody's not going to walk up and touch it if it's out. And then that way too, it keeps, if you put it in there in a certain position, like hopefully it will stay that way so that you can keep that differentiation between the front and the back of the mask. As far as general doctor's visits, a lot of parents have kids that are getting vaccinated right now. So just know that if your child is younger, like 5th grade or younger, and they're due for vaccinations, the pediatrician may still want you to do that. But if they're adolescent or older, they're tending to delay those right now. If you are a diabetic or if you have hypertension, those things do put you at increased risk, but there's solid evidence to show that if those things are well controlled, like if your blood sugars are in check and your blood pressure is within normal range, that is shown to help improve outcomes. So it's important to stay taking your medication, continue to watch your diet, because that will really make a difference with your outcomes. So what is the CDC definition of high risk other than what we talked about already? People over the 65, people living in long-term care, chronic lung disease, and this is defined as like COPD or moderate to severe asthma. There's not seeing a lot of increased risk for intermittent asthma or seasonal allergy-induced asthma. Heart disease with complications, immunocompromised, obviously, people with a BMI greater of 40, underlying medical conditions, particularly if not well controlled. And then again, people who are pregnant, they don't show to be of increased risk, but they can contract it just like anybody who's not at increased risk could. So again, if you've got something that you're managing long-term, from a doctor's office's standpoint, make sure you have a lot of supply of your medication. We're being very liberal with this right now. So even if we haven't seen people for their necessary checkups, we're making sure that they have 90-day supply so that they don't have to have as much contact with the pharmacy. And if you are a diabetic, have a kit put together so that if you do ever have to go into the hospital, you can do self-checks with your blood sugar, because that will just keep you safer, the less people who are entering your room. We're telling people, make sure you have a thermometer at home, because we're getting a lot of calls from people who are saying, I'm having these symptoms. I don't know if I have a fever or not. I feel hot, I feel chilled. But it's very hard to differentiate this, especially with all the weather changes. Women in menopause, it's very difficult to tell whether you're having a hot flash or whether you're having a fever. And that's one of the things that has been more definitive than other symptoms, is that the presence of even a low-grade fever is more suggestive of an infection than not. And so it's very helpful for us to help decide how to educate you if you can tell us definitively whether you've had a fever. So if you think that you've been infected and you fall into that low-risk category, so the CDC just put out testing guidelines, and this has been updated since I wrote this document, but they've made 3 tiers: Tier 1, Tier 2, and Tier 3. So Tier 1 is high priority. This would be hospitalized patients or healthcare workers with symptoms. And these, when we're doing swabs for COVID, we're labeling Tier 1, Tier 2, or Tier 3 on the swab to be sent to the lab, and they're running these in priority of Tier 1, Tier 2, Tier 3. So if you're a Tier 1, you might get your test back in 2 or 3 days. If you're a Tier 3, it might be 8 or 9 days. So Tier 2 is greater than 65 years of age and symptoms, long-term care facility with symptoms, patients with underlying conditions with symptoms, first responder with symptoms. So basically, if you're high risk and you have clear symptoms, including a fever, that would fall into Tier 2. Priority 3 is basically anybody who doesn't meet the criteria of Tier 1 or Tier 2, okay? And that would include people with generalized symptoms, individuals with mild symptoms. But what we've talked about in the healthcare community, even though they have a classification for this group, the majority of the doctor's offices are not recommending testing for Tier 3 groups because we know that the shortage of supplies is coming. It's already here, but it's going to get worse. And so they're prioritizing testing for Tier 1 and Tier 2. The other reason we're recommending not testing for Tier 3 is because with the turnaround of 8 to 9 days, the treatment versus a positive test versus a negative test is not different. We're going to do supportive care regardless. There's not a treatment for us to give you, and we're going to tell you the same recommendations. So if you fall into one of those categories where we would even consider testing you, we would say consider yourself positive and follow the guidelines for a positive COVID case, because that's the safest situation for you and any close contacts. And so that would be quarantining yourself for 3 days after you're fever-free and 7 days after your first symptoms started. And for close contacts, they would want to quarantine themselves for 14 days. And this would mean, like, if your husband was infected, the wife is still working, she stays home from work for 14 days. Okay. And if you need to get a note for your workplace, the person who is suspected to have the illness needs to call their doctor. Their doctor will email them a note, and that person who needs to be quarantined for 14 days can take a copy of that note to their employer. So that's how that we're communicating that to employers. And that is really what's going to keep you the safest. If you get respiratory distress, whether you test positive or negative, we're going to tell you to go to the emergency room. The other thing about testing that's very tricky with this is that it has about the same sensitivity and specificity as the flu test, which you may or may not have been told by your provider before. But if you test positive for the flu, you're positive. If you test negative for the flu, there's a 40% chance that you could have the flu, and it was the test was not sensitive enough to catch the virus on the test. And so there's been a lot of concern in the healthcare community about people going for testing and getting a negative result and having some false reassurance that they're okay to enter society when they could very likely still be carrying the virus. So tests are only valuable if they test positive, because that's the only thing that we can say definitive is, yes, you have the virus if you're testing positive. So that's why Tier 3 hasn't been a high priority, is because the test isn't perfect. So that the safest thing that you can do still is just isolate yourself at home, treat supportively, keep your immune system high. So if you're tired, rest. Try not to react to the symptoms, because stress depletes your immune system. Sugar depletes your immune system. The two biggest things that I talk to my patients about that it depletes your immune system are sugar and stress. And so if really all of us for preventative purposes should try to limit those things as best we can in a pandemic. But that's the biggest thing, is rest when you're tired, stay away from those two things, eat a healthy diet, get fresh air, exercise if you're able to. And those things all will help increase your immune system and your body's reaction to this. So I think we've gone over most of the information. And all of that with the 3 and 7-day rule is listed at the bottom of the document. I put some resources on there that have been helpful for our family just so that we don't have to leave the house as much. But there's lots of different companies that do similar things out there. Does anybody have any questions?
What about using inhalers, Ashley?
Yeah, so that's a good point, Cece. So what we've seen clinically, and we have meetings with doctors all over the United States through our company, is that when people have shortness of breath or kind of a tightness in their chest, albuterol inhalers, which are a short-acting beta agonist, have shown to relieve symptoms. So to give people a little bit of relief. There's not clinical data to show whether that's actually treating the illness and preventing hospitalizations. But we are prescribing albuterol inhaler for people who have shortness of breath and tightness because it does seem to help them symptomatically feel better. And part of our concern with this too is that people will go to the emergency room because of just anxiety. So we're hoping that it will help with that. Mm-hmm.
How close are we getting to the 5-minute test?
So the 5-minute test, we're getting closer. They're going to be rolled out first in the hospital. So I think the question is, how close are we getting those to outpatient facilities? I think it's going to be a while. There's a lot of hospital demand before they're going to hit anything outpatient. I think what's going to help most is whenever we can get as many people tested as possible. And because one of the things that's going to slow this down is when about over 50% of the population becomes infected, they're essentially over the 50% of the population has like a vaccination to it because they're immune at that point. And so that's part of what's going to help reopen society is when enough people have had the virus and recovered, and they now have their own immune system as protection against it, at least for the immediate future. And then that's going to slow the spread just because the virus is going to bump up against people who've already had it and not reinfect those people. So getting more testing is important, but we're not there yet because the basic facts are we just don't have the supplies to do that. And so until we get the green light from a supply standpoint, I don't think we're going to be able to get the data that we need to really give us a lot of information in that area. There are some specific areas of the United States that are testing well healthy and sick people, and they're trying to get more of a understanding of how much of the population has truly been infected and just been carriers of the disease, so that we can get a better idea for how close we are to that 50% mark. Yeah. So unprecedented. Doctor's offices, a lot of them are working from telehealth. We really want you guys to stay up on medications, stay up on your own health, because we don't want people to become more immunocompromised because those things aren't being cared for as they should because people are afraid to come in. So we can do it a lot over the telephone. We can do a lot through telehealth. So at least call, and we'll make sure that doctors' offices are being very accommodating because we realize the risks of people not going without what they need. And don't get stressed out homeschooling because that depletes your immune system.
As we talked about, there's some belief that there are multiple strands maybe of this virus now, and how will that affect immunity to catching it again?
Mm-hmm. Yeah, so the only thing that I can speak to with that is how that works with the influenza virus, because that's the only other model we have. But basically, if you have a season where you get influenza A and then you recover and you've got antibodies to influenza A in your system that recognize it, and then you become infected with influenza B, it just depends, but usually people have a milder reaction to influenza B, almost like they've had a vaccination to it because their body's been primed that this is a virus. So it gets kind of like a blueprint of how it works. And even though it's not the exact same virus, it gets a little bit of a cheat sheet into how the virus works so the body can respond better. I don't know if that's how this is going to work with the coronavirus, but that's what we see because the flu has thousands of strains. We vaccinate for the two most prominent ones. So we do see that with other things. And right now, seasonality is something that I didn't talk about, but right now they're not seeing, typically coronaviruses don't have a seasonality to them. The common cold is present year round. We're not seeing this necessarily get dampened by warm weather, but we are seeing that it is thriving to an increased extent in cool weather. So, and that could be because people's immune systems are more suppressed in the winter. We're not really sure the reason for that, but historically, coronaviruses have not been seasonal. Initially, I think they were hoping for a let up in transmission with the warm weather, which sometimes helps with evaporating droplets transmission. All right. Well, if that's it, thanks for joining. And if you have questions, let's see. I guess the best way to reach out to me. I just don't want to leave you hanging. I have a full-time job at the clinic, and so it's supposed to be part-time. It's become full-time because of the virus, and so I think
people could look at your resource pages, and then they could reach out to their family doctor if they have specific questions. If you don't want to,
Well, I just am concerned about not getting back with people. I think, like Barbara said, your family doctor is a good resource. The CDC website is very user-friendly, and it really outlines everything. They've got a ton of printouts and resources, and so anything that they're telling health care providers is on the CDC. So if you want to be privy to information that your doctor knows, go to the CDC because that's our gold standard for where we're getting our information.
All
right.
Thanks, Ashley.
Thank you so much for your time tonight.
Thanks, guys.
Take care.
Okay.